A better than expected jobs report shows U.S. employers added 339,000 jobs in May. That's the best growth since January, with gains in construction, leisure and hospitality, and healthcare. But Minnesota's workforce agencies are making a push to fill tens of thousands of open healthcare jobs, hoping to avoid a care crisis. The state has launched a new campaign in hopes of filling the more than 45,000 open jobs in that sector. WCCO's Alan Henry explains where the need is greatest and why state leaders say the problem could get even worse.
We can't be in a situation where nursing residential care facilities are closing just as more and more people are needing those kinds of services.
But that's the reality facing Minnesota's healthcare system unless something changes and fast. According to the Department of Employment and Economic Development, there are more than 45,000 open jobs in the state's biggest job field.
Home health aid and personal care aides, that's the single largest occupation in Minnesota. It's over 100,000 workers strong. It had some of the highest number of job vacancies.
Right now, there are more than 9,000 open jobs just for home health and personal care aides, and thousands more for nursing assistants, LPNs, and RNs. Wages may be a factor, but even RNs, who make the most of the four groups, still have the second highest number of openings.
Nursing and residential care facilities have been really hit hard. Those jobs are very fulfilling, but also very challenging. Wages had been really quite low coming into and out of the pandemic.
The state has launched a campaign to get more people interested in a career in one of these roles. It's a field they say won't be seeing layoffs anytime soon, quite the opposite.
We have an aging population in Minnesota. There are more older people, and that's going to continue over the next, couple decades. And so that creates a situation where we need more of these caring professionals.
Alan Henry, WCCO News.
More than 25% of nursing jobs in Minnesota are filled by new Americans. The state is also targeting high school graduates since a diploma and training is all that's needed for most entry-level roles.